Hello, Mrs. Edwards. My name is Dr. Singh, and I'm definitely happy to talk to you today a little bit about your husband's condition. As you know, I'm a neurologist, and he was sent to me from his previous provider. And of course, I do specialize in certain diseases, one of those being Parkinson's disease. And as you know, and your husband at this point, I did feel like, and determined based off of his symptoms and what's going on that he does have Parkinson's disease. So, what questions might you have? All right, so yes, I guess first and foremost, let's talk about Parkinson's and exactly what it is. I know it's new to certain people. I mean, probably all heard the terminology, but a lot of us don't really know what Parkinson's disease is. But it's a chronic degenerative disorder of the central nervous system that affects both motor and non-motor systems. So, really as to why people get Parkinson's, we really don't fully know. We do know that there are certain risk factors, associated with Parkinson's disease. In other words, if a person, things such as their heredity, age, environmental factors like, certain exposure to toxins, definitely can increase people's occurrence of developing Parkinson's disease. And we also know that men are more likely than women to develop it. Normally, if they do develop it, most people, they do develop it around the age of 60 or older, even though younger people can also get Parkinson's disease. So, usually with Parkinson's, when we do diagnose anyone with it, we do stage it. Parkinson is 5 different stages that can get progressively worse. Based off your husband's symptoms, I felt like he displayed symptoms that were more so in line with him having stage 1, just based off of the symptoms that were shared with me within his medical records, like his tremors and bouts of depression, trouble sleeping, constipation. Those things are still pretty mild and can be treated at this point, but they did fall more so into that first stage of Parkinson's disease. So a little bit more about how we're planning to treat this future reference. Um, you know, um, one thing that Parkinson's does, one mechanism is it decreases the amount of dopamine in our brains. And dopamine is a hormone, but it's also a neurotransmitter, and it communicates from our brain to our body. It's a communication mechanism within our body, and what it does is it helps us to remember certain things. It also is how our movement, our memory, like how motivated we are to do different things. All of that depends on dopamine. So one of the ways that we treat Parkinson's disease is with medications, that will increase dopamine and those hormones within the brain that can convert to that hormone. One thing that we're going to use in particular is called a carbidopa medication. We'll use it, but we'll also not only use that medication, which will, increase the levels of dopamine within, the brain, to help with the issues with the muscle weakness, him feeling more motivated, in other words, helping with the depression. We'll use those medicines for the chemical, significance and what they can help us with there, but we'll also want to also look at, different other mechanisms as to how we can also assist, such as being able to exercise, which will, an exercise regimen, which will help his strength, his coordination, and his balance, as well as looking at what he's eating and his diet, because I did note that, one of the symptoms there that he had displayed had said that he was constipated. And, so we want to make sure that he has a diet that's high in fiber so we can deal with the constipation. But we also want to make sure that he has a diet that's low in fat, so that we're also dealing with it and so that the medicines would much better work, because those things can mess with the medicines and how they help, within his body, so we do got a game plan. We'll continue to look at how he's doing. I'll continue to look at how he's progressing, his symptoms, definitely, it's not curable, Parkinson's disease, there is no cure for it, but at this point, we definitely do have some different, interventions that we can make as far as medically, as well as with exercise, and as well as with diet. So I hope I answered most of your questions on today. If you do guys still have any questions, don't hesitate to give me to reach back out to me or my office. And of course, I'll be happy to speak with you both. Have a wonderful day.